Today's another topic, this second episode, which is commonly made a mistake. I mean, all the time we made a mistake. Which is dental technician, laboratory technicians made mistake too for implant tissue management. Do you know the implant? Let me try to train you guys. I'm your mentor, like I said. I'm not a dentist, but I'm trying to let you know what dentist does. Okay? If someone lose the tooth, for example, one tooth like that, they falling apart, whatever root is problem, that they pulled out the teeth. Now, technically, they don't have any tooth. Make them really embarrassed, especially women, right? Especially dating someone, right? What they're going to do. Several options, okay? So we make the partial, acrylic partial, Nesbit, Maryland bridge, whatever. But if they decided to go to make implant, so place implant, so we fabricated, or dentists made a good surgical guide. What do you mean surgical guide? Which means teeth is set up exact the same size of the tooth, and then we make the hole, and then we give them guidance to the dentist. So dentist put it back to the patient's mouth. They trying to make the place implant. Implant company is a million company out there. So A, B, C, D, whatever they prefer. So the problem is whenever they place implant facially, especially like facially, and issue. So I prefer screw retain implant, which is retrievable all the time if I want to. But whenever you make the custom abutment and then another crown cement, that's okay whenever you put the temporary cement too. So that's not what I'm talking about. What I'm talking about, they place implant and then they take it out the gum and then they put it back to healing cap. That's the problem. Okay, healing cap is the diameter is very small. This diameter compared to the other Jason tools, its angle is different. What I'm talking about, if your diameter is very small compared to a little bit bigger tooth here, it's not going to match it. Whenever I restored restoration to single tooth, it's not look good. It's bad, really bad, because not only top. Let me show, I'm going to show the video too. Not only top, and then you can see the tissue area is very small. I mean, really funky. I mean, it's really horrible. Especially who wants to demand the high demand for aesthetic design. That's why I'm really concerned. Now, here's the good news. Doctors sent to us to make the temporary custom or temporary screw retain, which is instead of the healing cap, small, right? They have a bigger one, but the all two size is different. For example, upper teeth is more rectangular shape. The lower molar has a more square shape. Premolar is overall shape. All different. Especially here, it's tough to match the custom healing cap. So whenever doctors say, "Hey, look, I have an implant. Okay, so I need to put temporization." You know what that's meaning? We commonly mistake, we just neglect the tissue. Of course, they don't give me enough tissue just like this much, because tissue, whenever they place implants, really fast shrinks like this, maybe like this, 0. All right, so we push it back just like that. So technically like this, which is the implant abutment with positioning. All right, Ed, can you take it out, single crown? All right, can I see the abutment? That's good. All right, put it back. All right, that's good. Can you put some saliva?
Mm-hmm.
Thank you. That looks really good.
Mm-hmm.
So, here a little bit. Nice. Mira, can you take a look at it?
Mm-hmm. Yeah, that's better.
It's better, right?
Mm-hmm.
Way better. Oops, sorry.
Yeah.
Awesome. Nice job, Marcel. Perfect. Custom abutment. Trying. Alright. That's good. Really good. Take it out. Beautiful. Right? Thank you. So, don't be afraid. Whenever doctor gave us implant impression over from STL file, don't be afraid. You just make the tissue and grinding what I show you here. Just grinding, just like other teeth, just like tissue here, same thing. Don't be afraid. It's not going to fit. Yes, they have to cut it, the tissue. So my restoration, temporary restorations, I fabricated, we position it, we feel it, all right? It's tight, it's really tight. Either doctor have to grind tissue more cut away, and then they have to put more tissue back, all the way back. But this is good news. After 3 months, they have a beautiful tissue contour. So after 3 months, they send me the implant impression. just like wonderful. So then I can fabricate the beautiful restoration. So my point is here, whenever doctor said implant, okay, look, here's an implant, single implant, can you make the temporary for me? Yes, don't be afraid. Grinding what? Look at the Jason teeth. What Jason teeth look like? Shape, contour, follow exactly CJ. Okay, cervical area, and then make more hollow down, and then we make the custom abutment, and then we at the same time make temporizations. I'm not talking about aesthetic, okay? I'm talking about positioning, functioning. So this is the commonly dental laboratory technician commonly made a mistake all the time. So I do have cases, and sorry, I would like to share with you. Like I said, I'm your mentor. I know you fail. I don't know. This is the fail. So they sent me. So I immediately noticed it. They fabricate really flat, not good. So I cut it. Like I said, repositioning for the 2 lateral implant for this patient. Make sense? Okay, stay tuned. Give you the more information, live cases, and then you can see how much I grind, which is healing care. And also another live cases. Like I said, I love live case. I hate the sample. Okay, whoever show me the sample, I don't like it. Sample is sample. I want live cases. Okay, real live cases, patient case. I'm going to show you. Okay, stay tuned. Don't go. And then thanks for subscribing. Appreciate it. See you next time. Alright, this video is regarding the tooth tissue management, which is laboratory side. We make the more cut it away. Because doctor sent to us this photo, which is really flat. So we make this a little bit more, the better tooth contour, just like other teeth. Okay, and then we fabricated the lateral, just like other lateral too. I'm not talking about frosty, those color. I'm talking about functioning, about those tissue, this place implant. Make sense? Okay. So we just cut it, and then we fabricated custom abutment, and also we glue it. We just cement it. So this is the what look like. It's pinching. Don't worry about it, but looks like teeth. All right. We cut it. It's more than they think. So dentists have to cut more. So my final restorations, not only shape and contour with the Jason teeth, is girly looking. All right. So like this. Just like, but this is temporary. All right. So here is more gap than here. So doctor have to put it back after they cut away the tissue all the way. And this one, 2 fabrications, lateral, which is white calcification, with kind of not as good as the other side, but is brighter white calcification, and finalize it with tissue contour. So patient can wear this after doctor trim it, trying to fit it, trying to make convex. Okay, trim it, and they take the new impression, and then we can go by finer. Like I said, we set up the tissue more grinding and positioning. That's the key. Now, sorry to say that, so this one is that's why it's a failure. It's under contour. Okay, we did not made it, but this is finer. If you think something's not right, that's why I'm trying to diagnose this for these cases. Okay. Hey, thanks for watching my YouTube video, and I hope to help you guys the better education and information. Sorry, but here's I put the height of a contour again, just like the other Jason cheese is make it look good. Just height of a contour, and then make the CJ over there. Okay.